The subglottis is actually below the true vocal cords. So the vocal cords are actually what causes your voice or what brings about your voice. Underneath that is the subglottis, and it's housed by a cartilage called the cricoid ring. So stenosis by definition is narrowing, and that narrowing could be because of scar tissue, fibrosis, which is essentially a healing process in response to some trauma at the level of the subglottis. So subglottic stenosis could be due to congenital forms. You could be born with a narrowing in this area. Or secondly, it could be, and most commonly, because of trauma in that area. And the most common traumatic or inciting factor is endotracheal intubation. And that will often happen if your child was ventilated and had a tube down the throat to actually allow the child to breathe. And the question is no, but there are important factors to consider that may increase the chances of your child developing a subglottic stenosis. One is prolonged intubation. Two is an oversized tube that is sitting right there. Three are high cuff pressures. So the cuffs that are around the endotracheal tubes that are overinflated. And four, traumatic intubations, usually by inexperienced people or students or learners. So often we use cameras, and those cameras could be used while your child is awake. We can do this bedside with what we normally use, a flexible nasolaryngoscope through the nose to assess this area. But more commonly and more definitively, the diagnosis would be made in the operating room while your child is asleep. And then we'll usually take some pictures just to show you the grading of that stenosis as well. So it depends on the grading system. Subtle, mild forms could be treated with medication. This could be steroid nebulizations, systemic steroids, sometimes antibiotics with steroids. And you want to calm down any other inflammatory markers or inflammatory causations of that, including reflux and that kind of thing. And again, this varies by grading systems, but we think about it in terms of dilations, which can be done endoscopically through the mouth with cameras. Injection of steroids and removal of tissue, again done endoscopically through the mouth, versus more open surgery that is done via neck incisions. And that's called essentially through the neck here, and we access the subglottic area. And to expand that area, we could use cartilage from the rib, cartilage from the throat, to increase the diameter of that subglottic area. Hope this was helpful. Take care.